Imagine a world where a deadly virus is no longer a threat to humanity. It sounds like science fiction, but on December 9, 1979, humanity achieved what many thought was impossible: the eradication of a virus from the planet. This day marked the end of smallpox, one of the deadliest diseases known to humankind. It was a historic victory, a triumph of human ingenuity, global collaboration, and relentless dedication to science and medicine. The threat of smallpox. Smallpox was a virus that had plagued humanity for thousands of years, leaving death and devastation in its wake. Caused by the variola virus, smallpox spread easily through respiratory droplets and caused high fever, severe rashes, and the development of painful pustules that eventually scabbed over. The disease left survivors with disfiguring scars and, in some cases, blindness. Before the widespread use of vaccines, smallpox was responsible for millions of deaths each year. In the 20th century alone, it is estimated that smallpox claimed the lives of 300 million people. Despite the devastation it caused, smallpox had one saving grace: it was highly contagious, but it didn't mutate as quickly as many other viruses. This made it easier for scientists to develop a strategy to fight it. The answer, in the end, was a simple yet powerful tool: vaccination. The birth of the smallpox eradication program. In the early 1960s, the World Health Organization, WHO, launched a global effort to eradicate smallpox. At the time, vaccines were already available, but the challenge was massive. The world was not as interconnected as it is today, and many regions had poor access to healthcare. The task was daunting: vaccinating every person on the planet who was susceptible to the disease. But the scientific community was undeterred. The strategy was simple yet incredibly effective: vaccinate as many people as possible, particularly those in high-risk areas, and ring vaccination, a method where health workers vaccinated those who were in close contact with infected individuals, became the cornerstone of the eradication campaign. The smallpox vaccine, developed by Edward Jenner in the late 18th century, had already saved millions of lives. Jenner's discovery that cowpox could prevent smallpox laid the groundwork for modern vaccination. However, it wasn't until the WHO took charge in the 1960s that a concerted global effort was made to completely eliminate the disease. The role of vaccination. The global smallpox eradication campaign relied on mass vaccination efforts, with healthcare workers traveling to remote villages, jungles, and deserts to find and vaccinate people who had never been exposed to modern medicine. The vaccine was highly effective, and people who received it became immune to the virus. As more and more individuals were vaccinated, the virus had fewer hosts to infect, which slowed its spread dramatically. One of the most remarkable aspects of the campaign was its ability to reach the most isolated and vulnerable communities. Health workers set out to vaccinate every single person, from urban centers to the farthest corners of the world. They carried portable refrigerators and syringes, and even in the most remote areas, they worked tirelessly to reach everyone. One key element that made the smallpox eradication program successful was its ability to stop the transmission of the virus in localized outbreaks. This was where the ring vaccination strategy came into play. When a case of smallpox was identified, teams would immediately vaccinate anyone who had come into contact with the infected person. This approach created a protective barrier around outbreaks, effectively containing and isolating the virus. Challenges along the way. Despite the immense progress, the journey to eradicate smallpox was not without challenges. The virus was persistent and capable of hiding in remote areas, making it difficult to track and eliminate. Political unrest, cultural barriers, and limited resources in some countries also posed obstacles. But despite these challenges, the global community remained committed to the cause. The power of mass vaccination and the collaboration of governments, organizations, and healthcare workers was key to the campaign's success. In the 1970s, the world saw a dramatic decrease in the number of smallpox cases. By 1977, the last known natural case of smallpox occurred in Somalia. This marked a turning point in the battle against the virus. The smallpox team intensified their efforts to locate and vaccinate everyone who had potentially been exposed to the virus. The final victory on December 9, 1979, after more than a decade of global efforts, the World Health Organization declared smallpox eradicated. This declaration was a monumental achievement. It meant that smallpox was the first disease in human history to be completely wiped off the face of the earth. It was a triumph not just for science and medicine, but for humanity itself. The announcement was met with celebrations, and it marked the beginning of a new era in global health. The eradication of smallpox is often hailed as one of the greatest public health successes in history. It proved that viruses could be defeated through coordinated global efforts, and it demonstrated the incredible power of vaccination in saving lives. The smallpox eradication campaign also set the stage for the fight against other diseases, inspiring similar efforts to combat polio, malaria, and even diseases like guinea worm disease. The legacy of smallpox eradication eradicating smallpox had profound effects on public health around the world. Not only did it save countless lives, but it also freed up resources that could be directed toward other health initiatives. The smallpox vaccine continues to be a model for how to approach infectious diseases. The success of the eradication campaign proved that with the right tools, strategies, and international cooperation, humanity can overcome even the most difficult viral threats. However, smallpox remains a cautionary tale. While the virus itself was eradicated, stocks of the virus still exist in 2 labs, one in the United States and one in Russia. These stocks are held for research purposes, as there is always the possibility that the virus could be weaponized or accidentally released. The careful management of these stocks continues to be a topic of debate, but smallpox eradication remains a beacon of what is possible when we come together to tackle a global challenge. The day smallpox was officially erased from the planet was a monumental victory, a moment when the world saw the power of science, vaccination, and global collaboration. It was a day that proved that viruses, despite their devastating power, could be defeated. But smallpox's eradication also serves as a reminder of the ongoing battle against infectious diseases. While smallpox is gone, other viruses still threaten humanity. The story of smallpox reminds us that progress is possible, and that through innovation, determination, and global cooperation, we can win the fight against even the deadliest viruses. The day we erased smallpox from the planet is not just a triumph of the past, it's a blueprint for the future.